I'm Dr. Patrick Andersen of Madison Maximize Living. 1 in 2 people have chronic pain in the United States, and chronic pain has been shown to shrink the brain. Medication is often used, however, they have side effects and addictive tendencies. There is a natural way to help. The spine misaligns and interferes with normal nerve functioning, creating much of our chronic pain and health issues. Join co-host Stacy Hansen and myself as we cover spinal adjustments, the missing link in your health care, coming up next.
Welcome back to Maximize Living with Dr. Patrick Andersen. We're talking today about the missing link in your healthcare, chiropractic adjustments. So Dr. Pat, let's just start by talking about just spine problems in general. Why do we have so many spine problems requiring these adjustments?
Well, many of us have taken falls. In fact, babies, kids have about 2,000 falls by the time you're 2 years old. They bounce a little better than we do, though.
Yeah.
You know, but still, it's a lot of shot.
2,000.
And actually, the birth process itself is quite traumatic for both the child and the mother. And then we have long sitting, we have jobs that are repetitive or one-sided. And we have deconditioning going on where people are sitting too long and maybe not getting enough exercise. They're just plain sitting too long and then sitting in bad postures. And then you got your venerable couch slouch position, text neck.
Yeah.
Those are real issues for the spine. So the spine is under constant challenges. So really in any given day, 1/3 of all Americans have some level of neck pain, and actually anyone in the world. And 1/3 of all people have low back pain. Every day.
Yeah, I believe it when you describe some of those postures. You can think about how many times during the day it's easy to do some of those things too. So I can understand it. Now let's talk a little bit about subluxation. What is it? We talked about it a little bit before on the show, but as a refresher.
Yes, a subluxation is that shift or misalignment in the spine that puts pressure on the nerves. I can kind of demonstrate it here. You should have a curve in the lower back and a curve in the neck. And if we lose that curve, we'll often get sideways shifts in the spine. And when that happens, it can pinch the nerves.
Okay.
It's one mechanism, or it tractions the nerve. And then the organ doesn't get its proper nerve supply, that can start having issues. The muscles can be weak, so we use muscle testing to see if you have subluxation. And the joint itself may be really tender when it's out of alignment. And the actual blood supply and motion of the joint changes, so that the disc can start to degenerate, just like tire wear in a car. If your wheels are out of alignment, you wear your tires much faster. The same thing happens in the spine. But a subluxation is a misalignment of the spine or even extremities that interfere with normal nerve function. They don't all hurt. A lot of times they don't hurt at all.
Would you know if you had one?
Many patients are surprised when we check them and we find other areas that aren't working right. They just haven't hurt yet. So when is the right time to do health care? When it breaks down or beforehand and prevent it?
So an adjustment now, is that where you're moving these things around to the right place?
Yes, certain hand positions to readjust or realign the spine. And it's really a lifetime art. There are dozens of different techniques. And it's really not as forceful as one thinks, it's really finesse. It's all set up, the right positioning and the right angles, the right speed, the right depth. So it is truly a lifetime art to be masterful at adjusting the spine.
There's a lot to it. It's
It's
a very fine process. So can you show us a little bit here about kind of what happens inside your body as you're doing an adjustment?
Yeah, when we do an adjustment, not only does the spine align better, it then allows the spine to move better. So often after an adjustment, someone could extend their neck fully or turn without discomfort. The spine no longer would be painful. In many cases, there's less pain right after it. Posture changes right away. People stand up and I'm standing straighter right after an adjustment.
Right away.
And many times they'll breathe easier. Frequently, they'll sleep better at night because there isn't all this aberrant, we call it aberrant afferentation, all the signaling from all your body parts that were under stress, firing into the brain and keeping you from settling down into a restful sleep. We see increased blood supply to the brain With moderate neck pain, there's a 20 to 35% increase in blood supply to the brain.
Wow.
And with severe, as high as 30 to 45%. Let alone the nerve supply now coursing down the spinal cord out to those organs and tissues, directing all functions and all healing.
So there's really so much more to it. It just affects your entire body.
Right, and you know, just like imagine a child with their spine out of alignment, how much irritation is continually firing to the brain and really affecting their ability to think well or do well in school.
We'll have more about this right after the break. Have your questions for Dr. Pat answered on an episode of Maximize Living. Send your email to drpat@wi57.tv. Welcome back to Maximize Living with Dr. Patrick Andersen. We're talking about the missing link in your health care today, chiropractic adjustments. So Dr. Pat, you were talking a little bit before the break about how chiropractic adjustments can help your entire body. It's not just the spine.
Exactly. It helps your total circulation, it relaxes muscles, improves range of motion. But some of the things I didn't mention on the last set was it actually releases a lot of endorphins. Some of the primary endorphin producers in the body are in the upper neck.
Oh, really?
And so when there's a gentle adjustment done there, huge endorphin release that happens. And also, anytime there's interference with the nervous system, you stress your immune system. So we have immune measures that actually go up after a chiropractic adjustment within 15 minutes. So a person has better resistance. They fight better. Even the killer cell, natural killer cells, are increased when their immune system is functioning better.
Wow, so there's so many benefits to doing it. So let's talk a little bit about the neck on down.
Yeah.
So let's start with the neck. What do you look for when you're examining somebody's neck?
Sure. One of the first things we look for, if you turn to your side, is we look for head posture. And when common people have forward head posture, let your head just drift forward like that.
Like this?
Now that's not real becoming. I'm sure Stacy does not like this on television. But that's a forward head posture where we really want the center of the ear over the center of the shoulder. So we look for that. And then we look for the shape of the curve in the neck. Is it very straight or is it angled forward? We also look for any head tilt, like this. Some people actually walk around most of the day with their head tilted to one side and don't realize
and
it.
don't even know it.
And we look for an angle in the neck, like her head was actually shifted to the side.
Oh yeah, that's not
So there'd be an angle in the neck. So there's tilt, shift, and even rotations of the head. Then all of those load the spine abnormally, and when you do that, you do interfere with normal nerve function and normal wear and tear. Let's just say you wouldn't want to have your neck out of alignment and go play a football game.
Yeah, that seems...
You see what I mean?
Yeah, you can
tell. And that's
tell
why
just
so
by
many
the feel of
sports
it.
use chiropractors to help them stay their healthiest and recover after difficult games with all those collisions. So those are the things that we're looking at in the neck. And then we'll examine where we'll feel the neck and see if there's any tenderness of the vertebra. We'll feel for tightness of the base of the skull muscles, or we'll feel for tightness in the trapezius muscles. Everyone just says, don't stop when I touch them here.
Yeah.
You know, you want that.
We all get tightness there, don't we?
Exactly. And so those are the things that we're looking at, including a range of motion, where you turn your head as far as you can each way, left and right, and then forward and back. And we load it just a little bit to see if those joints have any trouble. It's a good way to find out if there's trouble in the neck, any misalignment, is just going through a range of motion. Then we do different strength tests where we'd simply have you turn your head and then try to hold it forward, and we'd push back.
Oh, okay, yeah.
And so there's a number of different strength tests that are really valuable for that. So that would cover the neck.
Okay, so that's a little, even more than I would have known. I wouldn't have thought there was one where you're kind of like off to the side and
there's
tilted.
every permutation you can imagine.
Anything could happen. So let's move down a little more. What about your mid-back?
Yeah, face that way for me. So what people are really concerned about is this hump, and they say, my mother had it, my grandmother had it. What is that? Well, it's actually bad posture over a long period of time. When the head goes forward, it often shrinks down, and it's a good way to describe it as turtling, where the head just sinks down and forward.
Yeah.
And that causes this area to move posterior and be more of a hump. It's called a dowager hump or dorsal kyphosis. But it really can be managed and reduced. As we bring the head back, as we take care of the mid-back, that can be slowed down, stopped, and even reversed in a number of cases. One of the things we look for after this area is what's going on just below that. Commonly, if someone has this dorsal kyphosis or dowager hump here, just below it, it flattens. And if you're viewing in the audience and you're with somebody, just take a turn and feel each other's spines. Do they have a roundness in this area? And is there a flatness in this area? Is it tender when you touch it? Some people will also have an excess roundness in this area called a dorsal kyphosis, like where the whole back kind of rounds forward like this. And we also check out the rhomboid muscles to see how much tension and tightness there is.
So there's a lot to it. We have more yet to talk about. Stay with us. We'll be right back. Have your questions for Dr. Pat answered on an episode of Maximize Living. Send your email to drpat@wi57.tv. Welcome back to Maximize Living with Dr. Patrick Andersen. We're talking about chiropractic adjustment today, and we've talked about the neck, what you look for in the neck and in the mid-back. Let's get into the low back and the pelvis next, because I imagine there's a lot that can go wrong.
Yes, there's areas. This is why it's a full-time job to be a chiropractor. Stand facing this way for me, all the way like this.
This way? All right.
So when we look at the low back, we're looking to see if there's too much of an arch here or too flat of an arch. Some people are actually slumped and going backwards in this area like that. And that's hard on the back as well. So some people have too much. We're looking for the general slant of the pelvis. And some will have too much of a slant, some too flat of a slant, you see? And then we're looking to see if there's a curvature in the back. We look to see if it's going left and then back to the right or either which way like that. And what you demonstrated there would be a pelvic shift. That could go either way. We could also have a pelvic rotation, just like this, where one hip is actually, when they stand, sticking back further than the other.
Okay.
And they think it's normal. It's because their spine is not right.
Okay.
There's also forward flexions of the pelvis or backwards flexions of the pelvis. Those are all things we look at in posture. And then, if you face this way, we always want to check range of motion. So like bending forward as far as you can comfortably.
Like
we'll bend
this?
forward, and we want to see how far you can go. Typically it'd be about 90 degrees, and then bend back. Anytime there's a subluxation, there can be discomfort as soon as you load it. So that's a nice test to see if there's an issue. And then we see how you bend side to side, bending like this. Do you have that full motion? And then check rotations and see if any of those hurt. There's actually an orthopedic test where we just load down like this, that if there's a low back issue, it often can hurt. It's called Kemp's test. So we'll also palpate the spine. Typically, if there's a subluxation present, it's tender right on the spinous process of the vertebra. And then, of course, there are strength tests we do, holding the leg up and out and holding the leg out and pushing it in. Between all the range of motion, the posture, we test leg length. Those are the ways that we can really determine if there's a low back or a pelvic problem. Now, additionally, to our clinical examination, we add x-rays. Now, we typically only take 4 x-rays, so not very many, but they're extremely valuable because we do 20 different measurements on there. Certain vertebral slopes and forward head postures and lumbar curve angles, pelvic rotations, a lot of things like that. So when we get done, we really have a good picture of what's biomechanically going on, so that when we put our adjustments together, they can be the most specific ones exactly for your body.
Exactly what they need. It's very custom made, very tailored to you. Do you typically do an x-ray then after they're better to compare, or can you just tell visually?
Well, you can tell visually too, but it's common to take an x-ray later as indicated to measure. Yeah, it depends on the degree and severity of the problems and their progress. But one thing I also wanted to mention was how important the feet, knee, and hips are in this whole process. If a patient has foot pronation where the feet are rolling in, typically you'd see it as flat feet. Well, that turns the whole knee in and the hip in, and this is where a lot of degenerative conditions happen in the plantar fasciitis, heel spurs, hammer toes, meniscus injuries, because the mechanics isn't right in the first place. Hip degeneration, the need for hip replacements, often from bad mechanics coming from the loading of the spine and pelvis on that and the forces of the foot torquing back up. So your feet have to work properly, having an arch, flattening, and then getting that arch back as you walk. And if your feet are pronated or rolled in, you're pretty much slapping instead of absorbing those shocks. And it goes right up into the spine and breaks down your feet, knees, hips, and back.
So if you're having some issues with your feet, it may be that you need a chiropractic adjustment.
Yes.
So stay with us. We have more on chiropractic adjustments right after the break. Have your questions for Dr. Pat answered on an episode of Maximize Living. Send your email to drpat@wi57.tv. Welcome back to Maximize Living with Dr. Patrick Andersen. We're talking about chiropractic adjustments today, and we worked our way from the neck down to the feet, but we forgot the TMJ.
Yes.
Remember, we're saving the best for last.
Yes, TMJ is such a fascinating joint. You know, 1/3 of all people don't function right in their jaw joint. And when they, it doesn't necessarily hurt, but it's just not functioning right. And when they get under stress or have a slip or fall or bump their jaw or, Lord forbid, a fight or something, their jaw, TMJ can be quite active, and it will drive you crazy when it's really hurting. Those that have TMJ, my heart goes out to you, because when it's active, it's really hard to sleep, it's hard to focus well. There's so much feedback from the jaw joint into the brain. You just can't hardly think straight when it's active.
Oh, wow. So people, if they have it, they know it.
Yeah. And there's really a direct connection. If people have a spinal problem like forward head posture or a shift to the side, over time that will affect the meninges and it'll actually pull the skull and distort the jaw joint enough that it'll shift out of place.
Wow.
The skull will shift enough that the jaw joint will shift out of place.
So how many people have this?
Well, like 1 in 3 have a dysfunction where if I was to look at them, it's not moving right. So one of the things we look for is an overbite. When you bite down, your teeth shouldn't overlap more than 1/3. The top tooth shouldn't go over about more than 1/3. And if you have a really deep bite, it'll tend to take, I'll demonstrate on my friend here.
Are you going to recite Hamlet
He's plastic.
for us?
Yeah. If with a really deep bite, this joint, which normally sits about like this, will jam up. Now there's a little disc about the size of a dime that sits right on top here. And if with a deep bite or clenching a lot at night with stress, that will cause the disc to slide forward. When that disc slides forward, then the jaw won't open properly. It'll be blocked. So this is where you get clicking frequently from. So if the disc is slid forward on that side, when you go to open your mouth, it can't open normally. It will shift to one side as you open. So we look for what is the opening position of that patient. It will also block the ability to fully open your mouth about 40 millimeters or so. You should be able to put 3 fingers in your mouth. Maybe not sausage fingers, but you know, regular fingers in your mouth. And you should be able to open your mouth that wide without clicking and without deviation. So when we hear that clicking and there's deviation, we start suspecting problems. Typically, the condyles here would be tender to touch then, and there would be weakness on having the person shift their jaw to one side and hold it there. We would push it back and see if they can hold it. We'd push it to this way, to the other side, and have them try to hold it there. And then we'd have them translate forward like this and have them try to hold it there. And if there's subluxation present in that TMJ joint, then they won't be able to have a good range of motion and they won't be able to hold those strength tests very well.
Wow, so there's a lot of ways you could find out if you have it. And I'm assuming you can even look in the mirror and just see how your
you can look in the mirror and see how your jaw is opening, and if you open wide. The earlier the click, the worse it is typically. The later the click, the worse it is. And we're looking for also muscle tension. Often along the side of the cheek here, there'd be a lot of, in the masseter muscles would be very tender. The temporalis muscles would be very tender, and as you have this TMJ, and sleep is often disturbed.
So what do you as a chiropractor do for this?
Yeah, there's a specific adjustment we do to bring the jaw down, and it's a fairly light, rapid adjustment that just brings the jaw down. And we use the ligaments to pull the disc back on top of the condyle. And then when we get done, we retest the strength and we check the range of motion, and typically people will have better motion and strength right away. And if we can reduce some of that tenderness, we often get about 50% less tender. What's fascinating is that it's often involved when the neck has been bad a long time. It often draws the TMJ into it. That's really how we got involved in this in extremity adjusting.
Well, stay with us. We have more on that right after the break. Have your questions for Dr. Pat answered on an episode of Maximize Living. Send your email to drpat@wi57.tv.
Thank you for watching our show, Spinal Adjustments, the missing link in your healthcare. As you have seen, the science, art, and philosophy of chiropractic care has much to offer for those in acute or chronic pain. Many people are simply not getting the care that works best for them. If you or someone you know has acute or chronic pain, give our office a call at 608-833-1282. We'd be happy to help. For Maximize Living, I'm Dr. Patrick Andersen. Until next time, live well and God bless.
Have your questions for Dr. Pat answered on an episode of Maximize Living. Send your email to drpat@wi57.tv.